Hi, I'm Christy, and I'm going to be looking at exploring student perspectives on rural living. So in the United States, there's a huge issue with keeping rural healthcare providers and having retention. So a lot of agencies are saying that there's some issues with this because the impact is on the whole community from there. So these areas have a deficit of all types of workers, generally not just in the healthcare field. Rural areas are finding themselves understaffed pretty much on all levels. And this is something that I see within my own line of work very often. So my own study is planning to evaluate students' perspectives of rural healthcare and their own knowledge of the supports that are provided by the government to incentivize students to participate in these programs, as well as their willingness to be able to live in this region, in rural regions in the future. So some background on that, a lot of research has been done to look at ways to incentivize workers. So the National Health Service Corps Repayment Program reimburses licensed clinical social workers up to $50,000 per year, and that's a health shortage area, is actually like in most of Maine. So I was actually really surprised when I was doing my research that most places are only considered to be a health professional shortage area if the organizations have applied for this government type of support. So again, it's really based on the education that is available. So we have a need for competent social workers in healthcare in rural areas, and this is something that's needed no matter what. My research questions are going to be looking at, does the current location of the participant have an impact on their willingness to work in our rural or urban area? I'm going to be looking at the awareness of the educational knowledge, so if students are aware of the incentives to work in rural areas. And I also want to look at if students are aware of what a rural area is defined as, and if they're able to appropriately define where they live. So I've included a definition of rural, and then I've also asked participants to write their own location. So there's been much research that's been done on healthcare programs in rural areas and why there's a shortage. So the Affordable Care Act actually increased healthcare programs in over 30 states. Chapman, Phoenix, Hahn, and Strode of 2018 wrote research on California's mental health programs and found that because of the Affordable Care Act, more programs were able to hire more workers, but that many organizations weren't aware of the benefits that happened from the ACA. So it seems like, again, education is a huge thing here, and so other research also looked in to see, again, just if people are aware of if there's a need and the perception. So Young, Lindsay, and Ray, 2016, evaluated students' perceptions of rural practice, and they found that students didn't have a difference in opinion between rural and urban of opinions, but that these were new students that were being asked questions, and they were just interpreting essays, so it was really open-ended. So most of the research that I found on rural retention and perspectives really encourages that workers do more research on retention, just because this isn't something that's been looked into. It's been identified as a problem and a need, but there needs to be more work done on this. So future research should really just look into seeing what should be done. So that's why my study really looks at what participants are looking at for like their future. So I'm using a Likert scale. Most of my questions, so strongly disagree to strongly agree on, some open-ended questions on, not open-ended, some questions that I have on that. So just to clarify that last little rambly, I lost my train of thought for a second. So I'm using a Likert scale on several of my questions, and I just have statements that I'm having people agree or disagree with, and that's how I'm going to rank their knowledge. So they're facts, and I'm just looking for that. So I'm excited to continue doing this research project.